Let's jump right into heart rate variability. Now, heart rate variability, really, it's just the fluctuation of intervals between successive heartbeats. So we have high versus low. The higher means you have a better ability to have a parasympathetic state. Low means you have more sympathetic. And when we remember what parasympathetic and sympathetic means is, for parasympathetic, we are rest and digest, versus sympathetic, fight or flight. And so we want a high HRV because that means we spend a lot more time in parasympathetic state. We're resting, recovering, digesting. You get the picture. Now, with HRV, it's used really commonly right now for more sports-related, maybe science, stress monitoring. Yes, you'll get cardiologists, cardiac health individuals who are using heart rate variability now, but
they go more specific.
It's not diagnostic for them. This can be a lot more functionally used, I would say, and again, linked a lot with more recovery status. But it has a great way of predicting certain things like all-cause mortality, and these are things that we can pick out with heart rate variability. But again, diagnostically, you have EKGs, stress tests, things that give more information, I would say, right at the time that needs to be clinically relevant. So, Doc, what are some ranges, or at least ways that we can let the listeners know on how heart rate variability is usually measured, and then what does that look like as far as where we want to be?
Yeah, so when you look at measuring these different types of heart rate variabilities, a lot of it will come through, and the easiest way is wearables. I know Whoop is one that I've been wearing for, gosh, probably almost 5 years now. So it tracks the strain, stress, and the recovery rates quite well. So I look at things a little differently than actually like the milliseconds between successive heart rates, which can be done in a number of different ways. But if you're going to go more of a specific route, then you might want to go see a cardiologist, but they're going to be looking, like you said, at other variables with the diagnostics. So when we're looking at an average of the heart rate variability, that's for most people on average of 42 milliseconds between successive heart rates. It can range anywhere from 19 to even upwards of 75. And like you said, the better you can control your state from in a stressful state into a calming state, the better you can withstand certain challenges. So even, and I've used this before with my pets, I've used this with some of the kids that I've watched, babysat before, in terms of having a lot of fun, ramping up their system, and really engaging a playful, high energetic state, and then go into a calming state as quickly as possible. So not only are they able to re-regulate themselves, but they're able to withstand if certain stressful things come into their day, situations that they're able to re-regulate themselves on a quicker basis too. Yep. And that can be done whether you want to use your eyesight, whether you want to use your breath, whether you want to change your body state and the place that it's in. And I know we're going to get into a couple tools here in a sec, but one of the best ways that you can, if you're in a stressful state, to calm the system down is open up the eyes, create a big gaze to where you're focusing on the whole area of the room, or if you get better yet, it would be standing on top of a mountain, staring out across the whole landscape, which calms the system down. Longer exhale breathing as well.
It sounds simple, but you'd be surprised at just how effective simple breath work can be for heart rate variability, for stress, for anxiety, all the other things we talk about.
Yeah.
And I would recommend most start to look into that, because what you're going to find is it is going to start to improve a lot of the things that you might struggle with.
Yes.
People that get started usually fall asleep trying to do it because it puts you in a meditative state.
Yes.
And that's when I first started understanding the importance of it, because I was trying to meditate using breath work. I didn't really think of breath work as that important. I just thought, okay, I need to meditate. How do I start doing that? And then I found that it would help me fall asleep. And I was like, perfect, this is great. Little did I realize that it was breath work that was the very incredible, important part of that. And I was just learning when I first started jumping into this stuff. But yeah, I think, like you said, there's a lot of tools that we can use in both the short and the long term. So I took a lot of this information from Dr. Galpin and Dr. Huberman, and this is a mixture of both of their recommendations and what they both studied and learned. And so with short-term heart rate variability drops, first I want to just preface how Dr. Galpin explains heart rate variability. So he explains heart rate variability like a bowling lane. And he said that you actually want to touch the bumpers every now and again, okay? Because what that does is it allows you to put yourself into this state of stress, and then your body should be able to bring your bowling ball back into the middle of the lane. And that is important. That's heart rate variability. It's your ability to be engaged in a stressful state, but then to, like you said, very quickly come down and unwind.
Yes.
But he threw in a little bit extra kind of from what you were saying, is that if you never go and touch the bumpers, your lane gets smaller.
Yes.
And it's much easier for you to then get to that stressful state, and it's tougher for you to balance away from the bumpers because it's so close. So he goes, the more you practice touching the bumper, coming back to center, the bigger your lane gets. And I love the way you explain that, because that's exactly what you just said. He goes, you can put yourself into that state, and then your ability to come down quicker is improved. And that coming down can be used in, again, with short-term settings and long-term settings. So he just pointed out that if you are measuring your heart rate variability and you're seeing a poor heart rate variability score, it's lower, 1 to 3 days of that, it's possibly just part of either training adaptation or stress. Monitor it, hold steady, you're doing fine. However, 4 to 6 days, you're possibly overreaching, you're not recovering how you should be. Evaluate your stress, your sleep, maybe your performance testing. And then lastly, anything over 7+ days, he states, is already chronic stress.
Wow.
He states that more than likely you've been like this for a very long time, and you are overtraining, or you're not recovering, you're probably needing to eat better, sleep better. Some type of structure is missing.
Yes.
And that's, in a nutshell, how you can figure out what should you be doing short-term versus long-term. Now, 7+ days, we'll get right into long-term, because I think most people need this anyway. And that's, no matter what, sleep optimization is going to be what will directly link long-term heart rate variability improvement as a foundation.
Yes.
And so we can talk about all the things, sleep. We even had a podcast about that, actually, if you want to talk about it. But Whoop is helpful because it helps you figure out your deep and REM sleep, how you did that way. And I think the way that you explained it, you didn't really look at the milliseconds, because Whoop turns it into an algorithm using everything and gives you a score, right? Is that how it works?
Yeah, for the most part.
Yeah.
So they're really optimizing their scores, but as far as I can tell, they look at different stages of sleep. They look at the strain and stress on your body. They look at the heart rate variability going into sleep, out of sleep, throughout your day. And I'm assuming they have built in the certain stresses, because you, like you said with that analogy, you push those bumpers, the more you can stress the system. It might depend for each person on when you stress the system.
Of course.
It doesn't make sense if you're going to work out late at night and then try to offload and try to sleep within an hour afterwards.
Yeah.
Coming down from a stressful state that quickly is really hard, and then obviously affects sleep.
Sure, and like all these other variables that
100%.
But what's cool is Whoop can help you track that. You can have it ask you questions during the day, like, did you work out at night? Did you work out in the morning? Did you eat at night? Next thing you know, you have a month-long report saying, you slept really well when you didn't work out at night. Slept well when you didn't eat at night. And then next thing you know, you have all this data that can give you insights. And I remember seeing that data for the first time, and I'm like, whoa, caffeine kills my sleep. Who would have knew?
Yeah, and they break it down from weekly to monthly to even yearly too. I absolutely love it. It's not a paid promotion by any means, but we like talking about stuff that actually works and that we like to use.
Yeah,
For the most part.
not to say it would be awesome to have a paid promotion. Longer term interventions to help with heart rate variability, journaling, meditation. Again, we talked about breath work with that. Social connection actually shows long-term improvements in psychological well-being and heart rate variability. Hydration and electrolytes is actually helpful for long-term heart rate variability.
I love that. Just a smart idea.
Omega-3 fatty acids, believe it or not, can be helpful for that. And then reducing training load if you are overloaded. Now, short-term, this is just ways that we can try to improve performance and improve sleep, just the minor changes that we can do day to day. Cold exposure can be incredibly helpful to improve heart rate variability. Now, what it is interesting is it actually does exactly what we talked about. It hits you to your bumper lane, but then it has an incredible ability to rebound you back towards center. So doing this short term, but consistently, is a great way to help you get yourself to the bumper, and then you can practice yourself bringing it back online. Heat therapy is apparently the same thing, similar like sauna, and I wouldn't say it's as stressful as maybe as a cold therapy. Doc, do you agree?
Probably doesn't reach that side bumper as strongly as it does the cold therapy.
Okay, I agree with you.
Yeah, because you can push the parameters. If you're not used to sauna or heat therapy,
It might take 30, 40 minutes in that sauna. Cold, you can get there in 30 seconds, if that.
a couple minutes, yeah.
Yeah. Music, 10 to 30 minutes of favorite music can elevate heart rate variability through relaxation pathways. Lastly, breathwork, I would say, could be short and long term, obviously, too.
Yeah.
In the short term, we talk about how just a double inhale, exhale can be so helpful for improving vagal tone, decreasing pulse, and lowering your heart rate.
Yep.
Yeah. Lastly, I had recommended 3 ways you can start measuring your heart rate variability. Not only that, these other products can measure much more than that too. But Whoop is number 1. That would say that that's, from what I've been looking at, definitely the more comprehensive tracker. The next is the Ora Ring, which
I always want to try that.
there's actually, I looked into it, there's no real-time HRV. It's segmented in how it measures it. Is 24/7.
Which makes sense.
Yep. So it's limited in-day tracking, but from what I've seen, Ora Ring actually can have much higher sleep phase tracking or appropriate sleep phase tracking versus Whoop. Okay. And then lastly, the Apple Watch is very convenient because most people already have it. And then again, you can integrate it with certain apps and things like that, and very helpful for heart rate variability and sleep. But I know that Apple's already looking to add in more things to their watch. And I don't know if you know this, Doc, but they're actually looking to add a non-needle glucose monitor.
So smart.
It's like,
I wonder, without getting to the blood.
I don't know how they're going to do that. I don't know if it's going to be like I don't know. I'm curious how they're going to do it. They think they can do it.
Interesting.
So you'd be killing Dexcom and like all these other wearable, like you'd murder them right out. It'd be done. And now if they could implement what Whoop is doing and Ora Ring along with this, this would be the iPhone killing all the companies again.
Yep.
It's crazy.
And you look at the wearable glasses and stuff that they're going with, potentially VR down the road.
It's a little scary. Awesome. We've used almost all of those. I'm possibly about to buy an Ora Ring because I'm just curious. I've wanted to try one for a while now. And
exciting.
But the more I read about it, Whoop is still one that looks, maybe I'll get both. I don't know.